Welcome to Fila Health Systems of North Carolina, PHSNC. This is part 2 of our 3-part professional training series, Crisis Response, Overdose Safety, and Incident Reporting, Protecting Clients, Staff, and the Community. Part 2 is titled Narcan and Naloxone Use, Opioid Overdose Recognition, and Emergency Response. At PHSNC, we are guided by our mission to provide person-centered, compassionate, and clinically sound behavioral health services that empower individuals and families to achieve stability, independence, recovery, and meaningful quality of life. Our vision is to build stronger families and healthier communities, meeting individuals where they are, helping them overcome systemic barriers, trauma, and unmet needs, and supporting long-term recovery, self-determination, and sustainable success. We do this because we believe in helping you live your dreams every day. In this training, you will learn how to recognize the signs of an opioid overdose, how to administer naloxone, also known as Narcan, how to perform rescue breathing, when and how to call 911, and how to document and follow up after an emergency response. This training applies to all PHSNC staff, including peer support specialists, qualified professionals, clinicians, administrative staff, supervisors, and leadership. Section 1, Learning Objectives. By the end of Part 2, you will be able to identify the signs and symptoms of an opioid overdose, describe how naloxone works and when it should be used, demonstrate the correct steps for administering intranasal and injectable naloxone, explain when to call 911 and what information to provide, and describe PHSNC's post-response documentation and notification requirements. These objectives reflect our values of heart and impact, because every life we save is a demonstration of who we are as an organization. Section 2, PHSNC Values, Heart and Impact in Emergency Response. At PHSNC, heart means we genuinely care about the people we serve. It means we show up, not just in scheduled sessions, but in moments of crisis. It means we are trained, prepared, and ready to act when someone's life is on the line. Impact means our actions produce real, measurable results. A staff member who responds correctly to an overdose saves a life. That is the most direct form of impact our work can have. Naloxone training is not just a compliance requirement. It is an expression of our deepest values, the belief that every person we serve deserves to live, to recover, and to achieve their dreams. Section 3, Understanding Opioid Overdose. Opioids are a class of substances that include prescription medications such as oxycodone, hydrocodone, fentanyl, and morphine, as well as illegal substances such as heroin. In recent years, illicitly manufactured fentanyl has become increasingly prevalent and is responsible for a significant number of overdose deaths across North Carolina and the nation. An opioid overdose occurs when opioids overwhelm the brain's ability to regulate breathing. The person's respiratory system slows or stops entirely, leading to oxygen deprivation, unconsciousness, and death if untreated. It is important to understand that overdose can happen to anyone, including individuals in recovery, individuals receiving medication-assisted treatment, and individuals who have not used opioids recently and therefore have reduced tolerance. As PHSNC staff, you may encounter overdose situations in a variety of settings: in the office, during home visits, in the community, or when a client discloses that a friend or family member has overdosed. Knowing how to respond is your responsibility. Section 4, Recognizing an Opioid Overdose. The signs of an opioid overdose include unresponsiveness. The person cannot be awakened by voice or touch and may be limp or slumped over. Slow, shallow, or stopped breathing. You may hear gurgling or snoring sounds. Blue or grayish lips, fingertips, or skin. A sign of oxygen deprivation called cyanosis. Pinpoint pupils, very small constricted pupils even in low light, and pale, clammy, or cool skin. If you observe 2 or more of these signs together, treat the situation as an overdose and act immediately. Do not wait for confirmation. Do not assume the person is sleeping. Remember the phrase, unresponsive plus slow or stopped breathing equals act now. Section 5, What is naloxone? Naloxone, brand name Narcan, is a medication that rapidly reverses the effects of an opioid overdose. It works by binding to the same opioid receptors in the brain that opioids attach to, blocking those receptors and temporarily displacing the opioids to restore normal breathing. Naloxone is safe, fast-acting, and has no effect on a person who has not taken opioids. It is not possible to harm someone by giving naloxone when they do not need it. Naloxone is available in intranasal spray, the most common form, intramuscular injection, and auto-injector formats. PHSNC maintains naloxone kits on site at all program locations. Staff should know where naloxone kits are stored and ensure they are accessible and not expired. Section 6, Step-by-Step Administration of Intranasal Naloxone. Step 1. Ensure your safety and call for help. Tell someone nearby to call 911 immediately. Do not delay 911 while attempting to administer naloxone. Step 2. Lay the person on their back on a flat surface. Tilt their head back slightly to open the airway. Step 3. Remove the nasal spray from the kit. Hold the device with your thumb on the bottom and 2 fingers on either side of the nozzle. Step 4. Place the tip of the nozzle gently in one nostril. Press the plunger firmly to release the full spray dose. Step 5. If the person does not respond within 2 to 3 minutes, administer a second dose in the other nostril. Step 6. Begin rescue breathing if the person is not breathing on their own, 1 breath every 5 seconds. Step 7. Place the person in the recovery position on their side once they begin breathing to prevent choking. Step 8. Stay with the person until emergency medical services arrive. Do not leave them alone. Remember, naloxone wears off in 30 to 90 minutes. Opioids may outlast the dose. The person may go back into overdose. This is why calling 911 immediately is critical, even if the person appears to recover. Section 7. Rescue breathing. If the person is not breathing or has very slow, shallow breaths, provide rescue breaths while waiting for naloxone to take effect. To perform rescue breathing, tilt the person's head back and lift their chin to open the airway. Pinch their nose closed, create a seal over their mouth with your mouth or a face shield. Give 1 slow, steady breath over 1 second and watch for the chest to rise. Then repeat once every 5 seconds, approximately 12 breaths per minute. Continue rescue breathing until the person begins breathing on their own or until emergency services arrive. PHSNC provides face shield barrier devices in all overdose response kits. Section 8. Calling 911. Calling 911 is always the first step. It is never optional. When you call 911, tell the dispatcher your exact location, including building name and address, that you have a person who is unresponsive and not breathing or breathing very slowly, that naloxone has been or is being administered, and your name and contact number. Stay on the line until help arrives. North Carolina has a Good Samaritan law, also known as the N.C. Ryan Brown Act, which provides limited legal protection to individuals who call 911 during a drug-related overdose emergency. At PHSNC, saving lives is always the priority. Section 9, Staff Reflection Scenario 1. Scenario: you are conducting a home visit with a client enrolled in PHSNC's Community Support Services. When the client does not answer the door, you notice it is slightly open. You enter and find the client unresponsive on the couch. Their breathing is very slow and shallow, their lips appear bluish, and their pupils are pinpoint. What would you do? Here is what PHSNC policy and training require. Call 911 immediately. Retrieve and administer intranasal naloxone. Begin rescue breathing if needed. Administer a second dose if there is no response. Place the person in the recovery position once breathing resumes. Stay with the person until EMS arrives. Notify your supervisor immediately after the emergency is stabilized. Complete all required documentation and incident reporting. This scenario reflects our value of heart, the willingness to be present, to act with urgency, and to protect the lives of those we serve. Section 10, Post-Response Procedures. After an overdose emergency, your responsibilities do not end when the ambulance leaves. PHSNC requires immediate supervisor notification, do not wait until the end of your shift, completion of an internal incident report within the required timeframe, objective, factual documentation in the client's record, replenishment of the naloxone kit, and a debrief with your supervisor because overdose responses are stressful and potentially traumatic. Section 11, PHSN Specific Overdose Response Protocol. PHSNC's overdose response protocol is aligned with North Carolina DHHS guidelines, MCO and payer requirements, and CARF accreditation standards. Key elements include maintaining naloxone kits at all program sites and in field staff emergency bags, ensuring all staff complete annual naloxone training, documenting all overdose responses in the client record and internal incident reporting system, reporting qualifying incidents to NC IRIS as required by state guidelines, and conducting a supervisory review and quality improvement debrief following any overdose incident. Section 12. Key Compliance Reminders. As PHSNC staff, you are required to complete naloxone training annually, know the location of all naloxone kits in your work setting, never delay calling 911 in an emergency, document overdose responses accurately and within required timelines, notify your supervisor immediately following any overdose event or near miss, and report qualifying incidents through PHSNC's internal system and to NC IRIS as applicable. Section 13, Staff Reflection, Scenario 2. Scenario. You are working at the PHSNC office. A client arrives for a scheduled appointment, but appears confused and is having difficulty staying awake. Their breathing is very slow. A family member who accompanied them mentions the client may have taken prescription pain medication before coming in. What would you do? Here is the correct response. Take the situation seriously. Do not assume the client simply needs rest. Stay with the client and ask another staff member to call 911 and retrieve the naloxone kit. Talk to the client calmly and try to keep them responsive. If they lose consciousness or stop breathing, administer naloxone immediately. Follow all steps for naloxone administration and rescue breathing. Notify your supervisor and initiate incident reporting. Coordinate with the treatment team to ensure follow-up care and safety planning. Section 14, Knowledge Check. Question 1. What are the primary signs of an opioid overdose? The signs include unresponsiveness, slow or stopped breathing, blue or grayish lips or skin, pinpoint pupils, and pale or clammy skin. Question 2. How does naloxone work? Naloxone binds to opioid receptors in the brain, displacing opioids and temporarily restoring normal breathing. Question 3. What should you do if there is no response? 2 to 3 minutes after the first naloxone dose. Administer a second dose in the other nostril. Question 4. Why is it important to call 911 even if the person recovers after naloxone? Because naloxone wears off in 30 to 90 minutes, and the person may go back into overdose. Question 5. What are your post-response responsibilities? Notify your supervisor, complete an incident report, document in the client record, replenish the naloxone kit, and debrief with your supervisor. Section 15, Closing Statement. As we close Part 2, we acknowledge the weight of what you have learned. Being prepared to respond to an overdose is one of the most important things you can do as a behavioral health professional. It is a direct expression of our mission to provide person-centered, compassionate, and clinically sound services that empower individuals to achieve stability, recovery, and quality of life. It reflects our vision to build stronger families and healthier communities, supporting long-term recovery and sustainable success. And it honors our values, purpose, knowing why this work matters, heart, caring deeply enough to act, impact, saving lives through skilled, timely response, leadership, modeling preparedness and professionalism, advocacy, standing up for the right of every person to live and to recover. You are not just an employee, you are a lifeline, helping you live your dreams every day. This concludes Part 2. Please proceed to Part 3, Incident Reporting, Internal Documentation, and NC IRIS Reporting.